So welcome. So today we are going to discuss about hepatitis B virus in details in terms of medical microbiology. Okay, medical microbiology in terms of means here we are not going to discuss about what is the life cycle of hepatitis B virus, but instead we are going to focus about the disease they caused, what are their symptoms, and what are the treatment that we can use, what are the prevention that we have to take, and what are the vaccinations types also. Okay, and also what are the mode of transmission. Okay, so let's start it with the lecture. So the highly contagious liver infection is caused by hepatitis B virus. Okay, so remember one thing, that in case of hepatitis, whenever you find hepatitis, as its name suggests, it targets hepatocytes. Okay, hepatocyte means obviously liver. That means in every cases, whether it is hepatitis A or hepatitis B virus, it will target liver. Okay, so a serious liver infection caused by hepatitis B virus, and that can be easily preventable by vaccine. Okay, that means as a vaccine development is possible for hepatitis B virus, that means we have some serological markers on the surface of hepatitis B. Okay, so so this is a structure of hepatitis B virus. So as you can see, it is a double layered structure, right? This is layer number 1 and this is the double layer or double shelled structure. Okay, so here the capsid is icosahedral capsid, and inside the icosahedral capsid there is partially double stranded DNA genome. As you can see, there is partially double stranded, okay, DNA genome along with viral DNA polymerase. They carries viral DNA polymerase. Okay, so last time we have discussed about a virus that carries enzyme with themselves is HIV virus. Okay, so in the surface of envelope there is a antigen of which you can make a vaccine, that is HBsAg, that means hepatitis B surface antigen, as it is present on the surface. Okay, and in the there is all another type of antigen present on the nucleocapsid, that is HBCAg, that is hepatitis B core antigen. Okay, and another one is hepatitis B EAG, that is hepatitis B envelope antigen. So total 3 type of antigens present: hepatitis B SAG, hepatitis B CAG, hepatitis B EAG. Among them, vaccination on hepatitis B EAG and hepatitis B SAG is most preferable. Okay, so partially double stranded DNA genome, and they are 42 nanometer in diameter. Okay, and it is again double shelled structure. So in the surface of the hepatitis B there will be HBsAg antigen and also HBeAg antigen, and on the core there will be HBCAg antigen. So 3 antigen present on hepatitis B. That is why we can make easily vaccine against hepatitis B virus, because they are simply providing us the way. Okay, so let's move. So consisting of a lipid envelope containing HBsAg, as I have discussed, along with HBeAg also, that surround an inner nucleocapsid which is composed of hepatitis B core antigen, right? So nucleocapsid is composed of hepatitis B core antigen, and and lipid viral envelope is consist of hepatitis B surface antigen and hepatitis B E antigen. Okay, E for envelope. So complex with viral encoded polymerase and the viral DNA genome which is partially double stranded. That is very important information. So family is hepDNA virus viridae. Okay, species is hepatitis B virus and genus is ortho hepDNA viridae. Okay, hepDNA virus, sorry, ortho hepDNA virus. So incubation period is on average 90 days, within range 52 or 60 to 150 days. Okay, on average 90 days after exposure to HBV. So what we have learned? We have learned hepatitis B virus causes contagious liver infection. Okay, that can be easily prevented with the help of a development of vaccine. Hepatitis B virus is a partially double-stranded DNA genome containing virus, and also it contains viral DNA polymerase on its own, and it is double shelled structure. Okay, it consists of a HBsAg on the surface and HBeAg also, along with HBcAg that is present on the nucleic acid. So three type of antigen present in hepatitis B virus. That is why how easy vaccination development. And another advantage that we have in terms of vaccination development, it is a double stranded DNA. Okay, that means more specifically the DNA virus, right? Because DNA do not undergo too much amount of mutation as much RNA does, because the RNA dependent RNA polymerase do not possess any kind of proofreading activity, but DNA polymerase does, right? So that is the reason presence of DNA and presence of three kind of antigen help us to easily make a vaccine. So what is the route of transmission? So hepatitis B virus can be spread by exposure to infected bodily fluid. Okay, that can be anything, that can be blood, that can be serum, that can be sperm, semen, that can be saliva, everything, and it also can be spread by sexual contact. So symptoms is, as it is a liver infection, so remember that symptoms of hepatitis B, hepatitis A resembles quite with jaundice. So we can see yellowish of the eyes, yellowing eyes, abdominal pain and dark urine. Children do not experience any kind of symptoms. In chronic cases, liver failure, cancer or scarring can occur. Remember one thing, in case of hepatitis A, the liver infection is acute, but in case of hepatitis B, C and all that stuff that we have are all chronic. Okay, so condition often clears up on its own, but if chronic condition happened, then we require medication and possibly a liver transplant. So treatment is interferon alpha, responses in 30 to 40%, lamivudine, apivir, HBV, adifovir, dipivoxil, that is Hepceda. Okay, so we can simply remember about the interferon alpha with response rate 30 to 40 and lamivudine mainly. Okay, apivir, HBV, adifovir, dipivoxil, I think it will be quite difficult to remember. Okay, so in that slide we have learnt about the route of transmission. Okay, so route of transmission is exposure to infected body fluid, that can be anything, and symptoms are quite similar with the jaundice. So yellowish eyes, dark urine, pain in abdomen occur, abdominal pain, and in case of children there will be no symptoms observed, and if chronic infection occurred, then there can be liver failure, there can be possible chance of cancer and scarring can occur. Okay, the condition often clears up on its own if the condition is in the level of chronic infection, then it requires medication and often liver transplant. So what are the treatments? Treatment is interferon alpha, where response rate is near about 30 to 40%, as you can see, lamivudine, that is apivir, HBV, another one is adifovir, dipivoxil. Okay, so let's move to the next slide, that is the last one. So what are the diagnosis? How we can conclude that HB virus has infected that particular person or not, or the particular person is exposed to HBV virus? So as it possesses three type of antigen, remember HBsAg, HBcAg, HBeAg. So serology can help us, that is simply antigen antibody detection test. Liver chemical test, AST, ALT, ALP and total bilirubin test. And histology, immunoperoxidase staining can occur. And HBV viral DNA, most accurate marker of viral DNA and detected by PCR. Because remember, HBV viral DNA is quite unique as compared to other virus, right? Because it contains a partially double stranded genome, so we can use them as a marker and perform the technique PCR. Okay, liver biopsy to determine the grade, that is inflammation, and stage, that is fibrosis in chronic cases. Okay. So today we have discussed about hepatitis B virus. So hepatitis B virus is a contagious liver infection that can be easily prevented by vaccine due to the presence of three kind of antigen, where two are on the lipid viral envelope. The one is HBeAg, another one is HBsAg, and another one is on the nucleocapsid, that is HBcAg. Okay. So and it also possesses, it is relatively smaller, 42 nanometer in diameter, but well equipped. It contains its own viral DNA polymerase that is important in case of its life cycle, that we are not going to see here. And here inside the capsid there will be a partially double-stranded genome present along with viral DNA polymerase. So incubation period here is approximately 90 days. Range is from 60 to 150 days. Okay, after exposure. So after incubation period, mode of transmission through exposure to infected bodily fluids. Okay. So symptoms can be yellowing eyes, can be dark urine, can be abdominal pain. In case of children, we do not observe any kind of symptoms, that is unfortunate. And in case of in chronic failures, or in case of chronic diseases or chronic infection that usually occur, liver failure can occur. It can facilitate cancer or scarring. Okay. So the condition often clears up on its own, but if it is a chronic infection, then we need medication and often liver transplantation. Okay. So treatment mainly are interferon alpha with response rate 30 to 40, lamivudine, epivir, HBV, and adifovir, dipivoxil, that is Hepcera. Okay. And last, diagnosis, serology, liver chemistry test, histology, immunoperoxidase testing, HBV viral DNA, most accurate marker of viral DNA, and detected by PCR, liver biopsy to determine the grade, inflammation, and stage, fibrosis in chronic hepatitis or hepatitis, chronic hepatitis. Okay. So let's remember with me. So hepatitis B virus again is a partially double-stranded DNA genome containing virus. Okay. And it contains a viral DNA polymerase, okay, on its own, and it contains two layered structure or two shelled structure. Okay. And it consists of three antigen. That is why we can perform easily serology test for diagnosis and vaccination for prevention. Okay. So okay, and it is of 42 nanometer, okay, in size. So we have discussed about everything about the structure, right? Then incubation period approximately 90 days. How it can be transmitted by bodily contact, okay, bodily fluid contact of infected person, right? So and symptoms is yellow eyes, dark urine, abdominal pain, everything can occur. Okay. And children do not exhibit any kind of exposure. In chronic disease, there can be chance of liver failure, cancer, and scarring can occur. Okay. And in case of normal condition, it will clear up on its own, but if the condition is chronic, then we need medication and even a liver transplantation. Okay. So the treatment is interferon alpha, that is INF alpha, with recovery rate or response rate 30 to 40%. Okay. Lamivudine, very important. Lamivudine, okay, with epivir, HBV, and adifovir, dipivoxil. That is quite difficult to remember. Just remember about lamivudine and interferon alpha. Adifovir, dipivoxil, I think quite difficult to remember. Hepcera. And then we have discussed about diagnosis, that is serology, liver chemistry test, AST, ALT, ALP, and total bilirubin test, histology, immunoperoxidase staining, HBV viral DNA, most commonly accurate marker of viral DNA, and detected by PCR, liver biopsy to determine the grade, inflammation, and stage, fibrosis in chronic hepatitis. So vaccination, as we are telling about, highly effective recombinant vaccine is produced nowadays. Hepatitis B immunoglobulin exposed within 40 to 48 hours of neonate and incident whose mothers are HbS and HbCAg positive. That means newborn babies whose mothers are unfortunately HbSAg or HbEAg positive are exposed to hepatitis B immunoglobulin within 48 hours. Okay, so that our immune system, the immune system of that particular child, can develop antibody for hepatitis B. Other measure is screening of blood donor and blood and body fluid precautions. Okay, so that is the various things that you need to know about hepatitis B. Okay, so I hope this video will be helpful to you, and if it is, please hit the like button, share with your friends and subscribe to my channel to get more videos like that. I will again come back with another video lecture regarding hepatitis, where I will give you a chart that consists of hepatitis A, B, C, D and E also, and it will consist of everything, okay, from mode of transmission, the type of genome, everything. Okay, so I will try to upload this by evening. So till then friends, bye bye.